Welcome to episode 8 of the Think Tank podcast, brought to you by the Digital Innovation Group at Providence. Think Tank is a supercharged brainstorming session between two leaders from different verticals to help us solve some of healthcare's biggest challenges. This is Kelly Stonelake. Thank you for joining us. Today, we'll be discussing the concept of access and convenience, which has become much less a futuristic idea and much more a here and now reality over the past 15 months. Joining us today is Sara Vaezy, Providence's Senior Vice President, Chief Digital Strategy and Growth Officer, and Oliver Meinzer, who is the Vice President of Global Operations, Digital and Mobile Guest Services for Marriott International. Marriott is an American multinational company that operates, franchises, and licenses lodging, including hotel and residential properties. Welcome, Sara and Oliver, and thank you for joining us today.
Great to be here.
Thank you. Looking forward to the conversation.
Me too. Yeah, we have had a couple of really interesting conversations on this podcast about distributed care and distributed care models, as well as a lot of discussion around digital acceleration. And a theme of these discussions, it's also been highlighted in the Digital Innovation Group's Where Does Health Happen report. It's this notion of nailing the balance between digital and physical. And this is more and more relevant. I mean, we've been talking about this since we started talking about this before the pandemic started. And of course, it's become even more important in healthcare and in hospitality and so many other industries. So couldn't be more excited to be having this conversation today. And at the end of the day, this is about making digital more personal, but also, as the Where Does Health Happen report puts it, it's about how health systems can harness the momentum of virtual care to build holistic blended experiences, right? It's not an all or nothing sort of deal. And to nail this, we're going to have to find the balance. So Oliver, I couldn't be more excited to have you on the podcast with us today. I am a Bonvoy loyalist, and I was an early user of the Bonvoy app, including my first contactless check-in and contactless hotel key experience, which was pre-pandemic. So thank you for Marriott's leadership and the investments you're making in digital disruption that have led to that access and convenience, and things like, robots delivering my Diet Coke to my room at midnight, just a real joy. Can you tell us a little bit about what you do at Marriott and how you're approaching virtual hospitality and contactless guest experiences?
Yeah, absolutely. Again, thanks, Kelly, for having me on. This should be a fun conversation. And we are definitely, me and my team are in the middle of this work where we bridge digital and physical as well as the human interaction, right? Because that is what hospitality is all about. So think about my team as kind of the operational product leaders of all the digital services we're offering for your hotel stay. We are partnering very, very closely with our digital product leads, as well as our partners in brand, our partners in human resources, and in other disciplines, to really bring that strategy to life. And it's not just about building the right technology, because you also have to make sure you can execute this technology. We have 7,000 plus hotels with 30 brands all around the world. I think the latest number was 147 different countries. So there is a lot of nuances that we have to account for as we activate experiences, as we account for what customer needs are in one country might be different than in others, what our associates that work the front line, how they execute. So that's where our team comes in. We're part of the process as we design and develop features and functionality, but then we also take those and activate them in all of our hotels around the world. And the way we look at this is really about it's really about the business objectives we are trying to accomplish. And in many instances, a lot of things have changed over the last 18 months, where it was primarily a loyalty benefit component for those of you, and Kelly, you were one of them, as you just said, that have used the features. It was a Marriott Bonvoy member through the Marriott Bonvoy app. Obviously, the travel behavior has changed quite a bit over the last 18 months, with much, much more of a focus on leisure and family travel, and less so much about the traditional frequent business travelers. So obviously that forced us to change our thinking a little bit. So now this is really all about, how are we creating an environment where travelers feel safe, where contactless becomes much more than a convenience or a service feature. It becomes now a purpose, because our travelers want to feel safe. They might not want to interact in person because they're still concerned about their health. So that is one area that has changed that we're really focusing on, and it also helps us from a prioritization perspective. The other lens that we now have on contactless is this notion of, how are we changing our operating model in our hotels? Because as you can imagine, with no occupancy for an extended period of time, our owners and operators are hurting. You know, you've probably read it in the media. As an industry, we have a hard time getting workers back. So how do we change the model? How do we use technology to deliver the experiences that our customers expect in a little bit of a different way? Automate to elevate, as we call it in some areas, that then frees up capacity with our associates to really focus on some of the service interaction. And then the third component I would mention here is we really got to protect the hotel stay, because we got competition for our customers, for their preferences from not only our hotel competitors, but everybody around us, name Google, Facebook, Amazon to some degree. But there's a lot of other players that are more and more interested in what's happening in our hotel stay. So it's very important for us to also focus on that and create compelling products and experiences.
Wow. Yeah. So I want to get back to touch on this operating model piece in a little bit, because there are so many things you just said, Oliver, that are so analogous to some of the healthcare challenges we've discussed. And I'm sure Sara has perspective and experience on too. So excited to dig into that. But first, I mean, you mentioned safety and purpose as being really important factors guiding your current orientation toward contactless and the digital acceleration and blending these experiences. And so Sara, you've been a leader in this space for some time, and even before the pandemic narrowed our gaze on healthcare as an industry necessary for disruption, you were launching some pretty incredible things. We had the HIPAA compliant Alexa skill that can schedule or cancel appointments, both at Providence and Swedish Express care clinics. And then more recently, the CDC compliant chatbot you built via Microsoft Tech for COVID response. So, you've been a leader in virtual visits and multimodal digital care enablement. And I would love to hear a little bit about when listening to Oliver talk about the transition from being a loyalty play and a convenience play to being more about safety and purpose. What rings true for you here? And more broadly, can you tell us a little bit about how you're approaching virtual access and convenience, and how this approach has changed given the digital acceleration and the shifts in patient and consumer needs that we're experiencing?
Yeah, absolutely. And as I was listening to Oliver, the thing that there's so many remarkable analogs between healthcare and the hospitality industry, in that fundamentally, we are both providing offline services. We're providing experiences, whether they are hospitality experiences or healthcare experiences, that are in some way physical in nature. We're not purely digital companies. We're not digitally native companies, but we do tremendous amounts of digital enablement of offline experiences. And so, it's very fundamental to the fabric of an organization that those offline experiences, we maintain those. And at Providence, we have this kind of concept of the sacred encounter, when a patient and a provider, for instance, are interacting around some sort of clinical encounter or issue. And that's like your hotel stay, right? Or your vacation that you're on. You're not doing it in VR quite yet. You're doing it physically, right? So that's the physical experience that we can wrap a lot of digital things around. And so, when it comes to things like, not just being about loyalty or about convenience, but really getting to fundamentally how a product or a service is delivered, what we're thinking about with respect to Providence is that we're in the past, we've been relatively rigid in how we viewed the sacred encounter and how we viewed how patients can access that sacred encounter. And it was, you book an appointment, you call it, first you actually have to call up a number that you find with some difficulty, and then you book an appointment, and then you get in your car and you physically go there and you wait in a waiting room, and hopefully you get your issue resolved, but it may be a relatively fraught and challenging experience if, it's at a bad time of day for you, or you have to travel across town, or the appointment is 3 weeks out instead of today when you really need it. And so taking all of those, challenges from a patient or consumer point of view, and we really thought about, okay, what do folks need? In many cases, they need care now, and they need it in a location or modality that makes sense. And when I say that makes sense for them, and when I say modality, I mean, it could be physical or it could be virtual. And when you say virtual, there are many options there. So the degrees of freedom expand significantly, whether it's a video visit or a chat-based visit. And that chat can be synchronous or it can be asynchronous. And that chat can also occur with, a bot, or it can occur with a human, a person on the other end. So, we really started to think about these degrees of freedom that can completely transform that experience from discovery through delivery of care. And you named a couple of examples of the things that we've done, Kelly, but I can talk a little bit about what we did with respect to COVID, because I think it illustrates the point really well, which is, the first challenge, like when the pandemic started, was people just needed information that was reliable. And so this is much more purely digital, but it really is digital information about a very real thing, right? They needed information that was reliable and it was easy to find and it was in a single place. They didn't have to go searching all around the internet and relying, kind of being left to their own devices. So that was the first step that we took. We stood up a hub for information. That hub for information was also pointed to endpoints for receiving sort of additional levels of service and care. The first thing that was this additional level of service and care was actually a chatbot. And that chatbot was a screening and triage chatbot for coronavirus symptoms. And it's not a symptom checker per se, meaning clinically, like clinical in nature, but it was much more about, do we think that you have symptoms that merits a sort of triaging to an actual provider. So the bot was doing some of the work to do the initial triage. This kept a lot of folks actually out of our physical settings and just gave them the information they needed, again, to keep them in their homes, to reduce their exposure, and to deliver it in a way that was convenient 24/7. They could go onto the website and actually do this, as opposed to, trying to call up a number or going into a physical location and potentially exposing themselves to coronavirus. Yet again, if there was an additional level of care needed, it pointed folks to a video visit appointment with a provider. And we were able to scale that video visit platform, which we'd had in place prior to COVID, up significantly. So there was a scale challenge there in terms of enabling this. And if folks needed even an additional level of care, it actually hooked people up with a home monitoring program that was also digitally enabled, where patients could put their data into, and these are folks that were actually ultimately, they tested positive for COVID, but weren't sick enough to come into a physical, like to be admitted into the hospital. It hooked them up with a thermometer and a pulse ox, and they could monitor their own data and input it at home, and then ensure that they weren't decompensating or anything like that. So if you were to take that COVID example and abstract it out to where there are multiple modalities and settings available, it's not just a virtual visit where a patient can seek care. You can imagine a world in which if you get screened for something, you then have a personalized set of options, whether they're physical or virtual in nature, surfaced up to you. And this is when we call it multimodal care. So it really is, if you want video and if it's appropriate for the specific thing that you're seeking at the time, that gets surfaced. If you want physical, that gets surfaced. And it is very, and by the way, the options that are surfaced to you have capacity to see you. That's how we start to think about the entire delivery and the operating model around care, which is truly hybrid, truly multimodal, and data-driven so that we know what folks need. So we understand the demand, we navigate them to the right venue of care or modality of care, and we match the supply and the demand within that context of that experience. And so that's how we see the future. And it can apply to kind of COVID-like use cases that are more urgent. It can apply to primary care-like use cases that you can actually schedule out some time. It can apply to specialty. And it's this, true hybrid operating model. And I'll give one other example and then I'll stop. It's one of my favorites because I think it applies to so many people and it really paints a very clear picture. The average expectant mom has about 14 visits during their pregnancy. And those often, we ask folks to come in and sometimes it's just very simple things like getting weighed and getting, your belly measured. Those types of things, those 14 visits don't necessarily all need to be delivered in person if you are a healthy mom or healthy expectant mom. Some of those should be in person because they require a physical examination. Some of them can be a video visit where you just do a check-in with a provider, and some of them can be completely automated and purely digital. And so we can actually envision a world in which we think about not just single encounters, but actual end-to-end experiences like a pregnancy completely differently in the context of this hybrid model as well.
It's so fascinating. I think the hybridization and what you described as far as the freedom enablement and the additional levels of service and care, it really adds a thoughtfulness and authenticity to weaving digital services and support into a typically very, not digitally forward care experience because of the fact that it feels personal, right? It's one thing to Google COVID symptoms and it's another to log on to the website of your healthcare provider and have a conversation. And the level of, I think, comfort and security that brings by feeling that direct engagement that really meets your needs, that's when you have the potential of really replacing some of the kind of in-person or different historical methods of modalities of care that come with some of the drawbacks that you mentioned, Sara. I'm curious, Oliver, as you listen to this and think about this notion of additional levels of service and care, I'm curious what rings through for you in your business and how y'all are thinking about prioritizing and experimenting and piloting kind of different approaches based on how needs have shifted. You mentioned the change from the business customer primarily to now you've got families that have been in their homes for a year and a half, like ready to get out there, but maybe feeling nervous about it or what have you. And I'm curious how Marriott's thinking about meeting those needs.
Yeah, I think, it was very interesting to hear Sara go through those details because there are a lot of parallels. They look a little bit different on our side, like picking up the theme around hybrid appointments. our travelers come to the hotels because they either want to be there at the hotel or they have to be there. So there's if we take the meetings and events out of the equation, there's really not an alternative to in person. But the way we look at it is more than from an experience perspective. Right? You all have stayed at a hotel. You come to the front desk. Somehow the associate behind the desk, they just seem to be very busy in putting more stuff into the computer. So it's very transactional. So a lot of emphasis, and that started pre-COVID already, and COVID has obviously put a little bit more emphasis behind it. But similarly to your appointments in your facilities, how much of these transactional items can we actually resolve differently? Do we really need to see your ID? Do we really need you to sign anything? Why do you actually have to stop by a reception desk or a front desk? A lot of the things that we're asking you, we can confirm differently. We can confirm that through the app. We can confirm that through our website way ahead of time, where it's much more convenient for our customers than it is standing in line at the front desk. So what we have done over the last couple of years, really map out what are these pain points, what are these transactional items, and really prioritize those where we can have immediate fixes to. So mobile key, Kelly, that you mentioned, that is one area where we said, hey, for those that really don't have any special needs or special requests, that really just want to get to their room, there's really no need for them to stop by. So we can make that really smooth. And then that frees up the capacity at the front desk to take care of those that really need some extra care. And that has worked out really, really well. And now we're trying to see, okay, we solved for what we refer like the happy path. Let's make sure we continue to increase that group of customers that literally can skip the front desk transaction, and we can make this a lot easier. Now, there's obviously nuances. Some of this is easier when you are in what we refer to the select brand part of our portfolio, which is your Fairfield Inn, your limited service hotels, versus if you go in the luxury space with our Ritz-Carlton, St. Regis hotels. There's obviously significant differences in how we solve for things. Foundational technology doesn't change, but how we activate this is obviously very different. So if you think about it, at a Fairfield Inn, you could expect at some point there's a fully self-service experience available, versus at a Ritz-Carlton, we'll always have, ladies and gentlemen, as we refer to our associates there, we'll always have ladies and gentlemen available, because then it's really all about choice and giving our customers options. But we also look at it through other areas of your stay. Food and beverage is another one that we have been very successful with, just providing contactless options where guests can order differently. They don't have to go and see somebody. They don't need to pick up the phone. And that over the past year and a half has been absolutely booming. And, we're on track this year to quadruple the revenue we generate through our digital channels, just from a food and beverage ordering perspective. But what it also, going back a little bit to the idea of hybrid, but a little bit in a different way, if you think about how our hotels operate, there's a lot of work that goes on behind the scenes to prepare for arrivals, right? We got to make sure we have the right room types so we can match reservations with the rooms, set up the accounts properly, address any special requests, answer any questions that would come in via phone or via chat. Right now, for the most part, this is all done at the hotel level. But technology also allows us to say, well, do we need to have this capability at every single hotel, or could we actually create some sort of market-based activation around this? So if you have multiple hotels in a location, could actually a team handle all of this for multiple hotels and change the model a little bit? Because you don't have to be at the hotel to be really, really knowledgeable about the hotel. And the way we have set up our communication channels, our customer relationship management tools, and the info we have about our guests and our hotels, it's very conducive to say that could be easily done We also have looked at hybrid work models where you might not be an associate at one hotel, but you might be what we refer to a market associate. So not all hotels have the same occupancy at the same days or the same patterns at the same days. So can we create a little bit different models where you not only pick your shifts, but then also hotels state what shifts they need. So you could work at Hotel A today, and then tomorrow you work at Hotel B, because the job functionality doesn't really change. You just need to be trained to know the nuances of each particular property. So I think some of the learnings and the market demands, the traveler demands, but also the challenges we have on the workforce side require us to be a lot more creative, a lot more thoughtful around how we solve for this and make this attractive. The other area where we've been really, really active is, well, what are some other opportunities outside of our core business, which is room nights? We are the world's largest spa operator. We are the world's largest golf operator, and we are the world's largest restaurant operator. So we have a lot more than guest rooms. So how do we redefine travel and not just assume travel is overnight stays, but also offer other ways to engage and stay connected to our customers and offer them local opportunities and create an even wider funnel to get customers into our ecosystem. Part of that too is what are other business opportunities outside of our direct list of amenities that we offer. So partnerships like we have with Uber Eats and others really have come to the forefront in really driving incremental value, for our loyalty members, but then also making this a benefit pitch, obviously, for non-members to join. One of the other areas where we have had tremendous success is expanding our business. Homes and Villas, which is our home sharing brand now, has been incredibly successful, and integrating that into our ecosystem has just been phenomenal success. And maybe not necessarily competing with Airbnb. It's a little bit of a different program, but making this available somewhat as a new alternative for the way our customers are traveling now. More family travel, need more space, looking for more unique experiences, maybe in unique locations. Again, the notion of safety. We want to be, for lack of a better term, contained amongst us. So that just has been phenomenal for us. And then last but not least, we're also super excited about a new business venture that's launching in the fall, and that's our Ritz-Carlton Yacht Collection, which will depart for their first voyage, I think, in Q4. So a lot of exciting things that help us with the changing travel behavior, new business opportunities to really help us grow our company and use technology, and in particular digital, as kind of the key priority to pull that through.
Wow. Talk about a list of incredible areas of exploration and investment. I just learned so much, and the connection between some of the challenges and opportunities you're navigating, and so much of what Sara shared and we've talked about on this podcast in the past are really surprising and cool. And I think one area that we've touched on a couple of times today that I would love to dig in more and see if this pattern continues is really thinking about the operationalization of this. So, clearly we're creating a lot of value for people, but what needs to happen from an operations standpoint for this hybrid digital physical model to be embraced and to be real and to scale? So, one thing I was just thinking about, Sara, is you've got this highly regulated industry. You've got really delicate relationships to manage between the organization and then the providers and the surgeons who have their own unique needs and perspective and may have different motivations to adapt or not. So I would love to hear a little bit more about that. And Oliver, please chime in and let's talk about where these operational challenges are similar and different between your two worlds.
Yeah, I suspect this is where probably some of the differences are going to arise, and some perhaps some surprising similarities as well. It's just so fascinating listening to Oliver. I think one of my biggest takeaways from this conversation, just in general, is that, and to your point, Kelly, we're not just talking about like a digital veneer on the same old way of doing things. We're talking about a different operating model, new lines of business, fundamental redesign. And so, with that in mind, like we can't just take the same, like in healthcare, for instance, we can learn from the Marriott kind of way of doing things, that we can't just take the same front desk experience, or in our case, like a waiting room even, right? And just replicate it online, right? We actually have to rethink, like, why do we even have waiting rooms, or what are the things that we can accomplish if we don't constrain ourselves to like this waiting room like model, or the old way of registering and checking in patients, and thinking about like perhaps we don't do it at a front desk at all. We provide kiosks, or we provide other mechanisms like, on your own device, or whatever the case may be. And so anyway, I just think that there's a lot of takeaways there. For healthcare, of course, is highly regulated, as you noted. And so some of the things that we need to do to operationalize all of these types of things are in the regulatory space. For instance, within the context of healthcare, there is a tremendous amount of regulation around how telehealth providers can deliver care, and in what states, and whether there is cross-state licensure, and whether there is reciprocity across states, and all sorts of like complex sort of regulatory things that, if we truly want to rethink, for instance, how we match supply and demand, those things need to get worked through. Another big area is around provider compensation models, and just how we fundamentally think about the financing of healthcare. It's very based around a fee-for-service, generally speaking, a fee-for-service payment model, like meaning fee for click for each click. Like you see a patient, you get paid, and different, there's a lot of coding implications and things like that. Like, is that really the right way to do business and to care for people if we are trying to achieve a new model of care? Chances are probably not. And then when it comes to provider compensation, we're often we're asking providers to work on a productivity-like model, which is in many ways tied to this fee-for-service model, and that creates different incentives for them. So there's a lot of stuff that needs to get done on that front within the context of healthcare to promote change. Another really interesting dynamic within healthcare, which I think actually this is where there may be some surprising similarities between what we do and the hospitality industry, is that many of our providers that work with our system are not employees of our system. They're independent providers, and they operate their own practices, and managing those dynamics as well is another challenge around, like, if you're asking folks to deliver care in new models, well, how you engage your partners, your affiliates within that context is very different than how you engage your own employees. And so I think those are just like a kind of some of the key areas. I'm sure I've missed quite a few, but those are some of the things that, we think about.
Marriott, we own very, 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 very little of our portfolio. The majority is franchise, or we manage for a third-party ownership group. In North America, for example, the majority of the portfolio is under franchise agreements. So Sarah, to your point, these are not our associates. So it's a fine line of what we can tell what to do and how to manage that. So it becomes very interesting on how we manage to do that. Now, there's ways, obviously, through brand standards and these kind of things, but you also always want to make sure it is some sort of a collaboration in the space. We also have regulatory items, and being represented in 147 plus countries, that also can get very complicated. To give you a little bit of an example, we're going back to what I mentioned earlier, how do we remove some of the friction points just in the check-in process? In the majority of the countries outside of US and Canada, you have to produce some sort of ID at check-in, either your passport or driver's license, and then you most likely have to complete some form of a registration card. In some countries, you have to do more. So how do we solve for that? How do we allow our guests to maybe do some of this before they even get to the hotel? Complete the registration card, maybe scan passport, do through facial recognition. Can they validate that they are whose passport they're claiming to use? And then store this obviously in a very secure way with partners. So we're talking through this right now, and there's nuances within every country, and then within each country there's nuances by city or by state. So it's a very, very complicated space, but a lot of fun to figure out. But I think that's probably maybe not to the degree of regulation you have in the medical field, but still there's areas that we need to be very cautious. Obviously, data privacy is a big item that we're very, very concerned about, and that impacts the way we operate. But yeah, I feel that there's a lot of similarities in terms of what it takes to operationalize this. To me, one of the critical things is whatever we deploy, it has to be seamless on both sides, on the guest and customer side, but also on the associate side. Because if it's not on either one, it's not going to be successful, because either the guests or customers are not using it, or the associates are not promoting it. And I think they're both equally bad. And we've learned that the hard way too, because at times, you want to move too fast, or maybe the technology that is out there is not quite ready yet, and then we struggle. And when we struggle, because with technology, as you all know, and I think, Sarah, you called that out a little bit, it comes with investment. And in our case, it comes with investment on our corporate side. But in many cases too, it comes with investment needs on the hotel owner side. Kelly, mobile key, that required our owners to invest in upgrading the door locks at every single one of their doors. So there's a need to get alignment across all our ownership groups that, we're okay doing that. But then also, obviously, there's the pressure from the ownership groups around ROIs. Well, why are not enough people using it? What are you doing about it? So that angle plays a big piece in there as well. And then moving forward, obviously last year put a big dent into some of the savings for such investments within our ownership group. So now the notion of how do we prioritize in the right way becomes even more prominent. So everything we want to do that requires owner investment, unless there's a really, really significant business case behind it that is attractive, not only to us as a company, but also to our owner and franchise partners, it is very hard to get any kind of alignment to make any sorts of investments from a capital perspective, but also from a human capacity perspective in the hotel. So it's going to be interesting, and that's probably going to take us another 2 to 3 years for a lot of our ownership groups / investors to cover.
I just actually wanted to build on something that Oliver just talked about with respect to it has to work for the users, in our case, our patients and our consumers, but it also has to work for our clinicians and our providers. And that's such an important point. We can't do one at the expense of the other. And going back to that COVID example, one of the things that the system did where we launched telehealth across our whole ambulatory network, meaning all of our clinics, our outpatient settings. And it was very fast. And it was a tremendous effort to get over 10,000 providers onboarded onto a telehealth platform and trained and using it. But it had a lot of challenges within it. Sometimes the tech didn't work. Sometimes they literally had to hold up laminated signs with information for the patients as they were looking at them on video on how do you turn on your audio. And it actually caused our providers to be less efficient, even though they weren't physically seeing people in their offices. And so that creates a lot of friction for them, and it's not sustainable. And one of the things that we've seen is that we've gone from our peak of about 50 to 60% of our visits being done during the peak of COVID by virtual mechanisms. We're now down to like 15 or so percent. And some of it is as a result of our providers just having difficulty with the platforms and going back to what works for them more effectively. And so it's a really important point that, we do talk a lot about being customer centered, and we do a lot of things to be customer centered, but it sounds like in both our businesses, both in hospitality as well as in healthcare, we really need to be extremely mindful of not doing it at the expense of those who are delivering that service.
Yeah, let's talk about that just a little bit more for a second. So both between the providers and the hotel operators who are not only the folks who are on the front lines seeing the challenges, but then need to deliver on the strategies built by your organizations. What steps are you both taking to insulate the strategic decisions from being made within an echo chamber, right? Where, some of the experience may not be fully considered or hard to predict. Like, how are these learnings impacting the way you're building strategies moving forward?
Yeah, it's a good question. We try to involve our frontline associates as much as we can, especially in my team. We're very, very tightly connected within our continent teams, within our regional teams, hotel teams, because those nuances vary by continent, by country. So this notion of change management that comes with every single one of these technologies or features or what we ask them to do is absolutely critical. One thing I learned very early on in my role is if we can't articulate to the impact of associates, what's in it for me, and why it makes sense for them to do something differently, it's just not going to happen. So that has always been a big focus for us from the get-go. And we actually have dedicated team members that sit in some of these design meetings and really with that lens, how are we executing this in our hotels? How difficult will it be, or how much simpler will it make the lives? Because that really is it's a deal breaker, right? If we're saying, hey, we have this great technology, it's gonna make check-in so much easier for the guests, but it adds 4 steps for the associates on their side, it's not going to happen. So we have really, really good alignment across the organization that, to the earlier point that Sara also made, is if it doesn't work and if it's not seamless on both sides, we're not going to pursue it because it's going to be a waste of money at the end.
I agree with Oliver, and just would add, we do similar work, which is engaging clinicians and other practitioners and operators across the organization in design, product development, rollout conversations, sort of at every step. They're a very key stakeholder. And so we work really hard to incorporate their voice into the requirement development as well as our patient voice. So we do a lot of customer research at multiple levels through market research, through actual, focus groups, through, doing testing with our users to inform design. So it's an absolutely essential component. And the one other thing I will say is that we're increasingly working on kind of adopting not like this waterfall mentality where we think that the product is going to be perfect or, do a big bang and then never change it kind of a thing. We don't do that, right? We build MVPs and then we iterate on them as we learn from users on both ends of the value chain. And so it's really important for us that we put things out for users to begin interacting with. And then we gather data. We've instrumented many of our platforms so we can gather the appropriate data and then make the needed modifications and build the features and do the development on top of that reflects what they want and need. Very, not necessarily something that's done all that often in healthcare per se, but something that we're from a technology and a digital innovation group standpoint and team working really hard on doing.
Yeah, similar process for us. With anything new, we do what we call a proof of concept, and that is probably the only exception to my earlier statement where it could be a little clunky because we might build a rapid prototype to just get some initial feedback. Well, can we operationalize this? Do customers even want to do this? And those are just things you can't do in a lab. You really got to get this in guest hands, got to get it in the associate hands. And then we learn and then we decide, do we want to continue that path before we spend too much time and effort? And over the last probably 6-7 years, we've gotten a lot more open to take a little bit more risks in testing new things so we can either fail fast or learn fast versus, to Sarah's point, in some of the previous decades where we said, well, here's an idea, we're going to build it until we think it's perfect, and then we deploy it. And that definitely wouldn't work these days anymore. Things are moving way too fast. And that also helps us to address, because there are immediate needs that need to be addressed, and we can't spend a year and a half developing a solution. We need to be able to be rather agile and get some of those issues resolved. The shift from a leisure business mix to 100% leisure, that is a big hurdle for a lot of our hotels that were built to be business hotels because they weren't business markets. And now with the changing behavior, they have, instead of one business traveler in the room, they have a family of 5 in the room, and they're looking for things to do, and they want to be at the pool. So there's an immediate need to address some of these things, which we can with quick POCs, and then if it works, give hotels a little bit of reprieve. But then from a longer term strategy, obviously these become then a lot more robust with the right research behind A/B testing, going into production runs with beta testing, and then get a group of early adopters working through how we would activate that.
Fascinating. Yeah. So, I mean, as far as this latest topic and how we kind of test and learn and iterate and keep up with needs as they change, we just have a couple minutes left, but I would love to hear, as far as this goes, like, where do you think healthcare and hospitality can come together and learn from some of these analogous opportunities and build in tandem? I mean, I'm just so surprised as an outcome of this conversation, really, how much overlap there is between the way you're both approaching providing to your customer, as well as, some of the challenges that you face in your operating models. So I'm curious, where do you think your industries could come together? Is there an opportunity for that?
I definitely think there's opportunities. I think, we to some degree, we're looking at some of the same technologies, right? How do we facilitate interaction, transactions, to some degree, experiences through technology? that no longer require in person. So maybe a little bit of a different purpose, but foundationally, I feel that there's a lot of similarities. So learning from each other, what works, what doesn't work. I think another area, just from the most recent part of our conversation, this notion of, well, how do we get our partners and frontline team members, associates to be successful, and how do we manage change management? How do we measure success from that perspective? I think there's a lot we can probably learn from each other.
Yeah, and Oliver just said something, which is where my head was going. One of the things that hospitality and travel got right pretty early was that getting folks online for that transactional experience sort of universally, and making it consistent and uniform, and ensuring that customers can book online, can pay for things online, can start doing a lot of the, registered online, can kind of do a lot of those transactional pieces that really, like, if software can do it, it should do it. Like they started that early. And we're still in healthcare earlier in our journey with respect to that, partly due to the complexity of the business and the needs of our patients and our providers. There are some unique challenges there, but I think that is one area where we can learn a tremendous amount around sort of this notion of being universally transactable. And another area where I think we could learn a lot is how to engage affiliates. And so, it's actually very similar, like how healthcare can engage with independent provider practices, especially if we're asking them to make investments that cost them something, and how you make that case to them. I think there's a lot we can learn around that as well. And I agree with everything else Oliver said too.
Awesome. I mean, I want to thank both of you for the work you're leading. Healthcare and travel and wellness are such important ingredients to kind of our overall health and well-being. And so thank you for these investments that you're making that I think enable people to, continue having access to really meaningful services as the world changes around them. So mad respect and props on that, and a lot of gratitude. And of course, thank you both for joining us and for joining this discussion today.
Yeah, this was great. Thank you, Sarah. Thank you, Kelly. This was a lot of fun. Hopefully we can do this again sometime.
Yeah, it was great. Thank you. Thank you, Oliver. And thank you, Kelly.
You've been listening to the Think Tank podcast, brought to you by the Digital Innovation Group at Providence. If you've enjoyed this episode, please leave us a review or follow @Prov Innovation on Twitter for more discussion about how digital can inspire solutions to some of our biggest challenges. I'm your host, Kelly Stonelake. Until next time, take care.